All right. Well, hello. My name's Tom. I'll be your PA student today performing your neurological exam.
Hello.
First, I'm going to wash my hands real quick. All right. So, first, we want to inspect your mental status, like your general appearance.
Okay.
I'm going to be assessing your affect, your dress, also your facial expressions, and cognitive function. And then now I'm going to assess your orientation. So, where are you right now?
Tom's house.
Tom's house. What's your name?
Katie.
Katie. And what time is it approximately?
Around 11.
Yeah, it's late. I have my watch on. Yeah. What's the date today?
June 1st.
Nice. All right. Now for the cranial nerves, the fun stuff.
Yes.
All right. So cranial nerve 1, olfactory. I want you to check nasal patency. So plug 1, breathe in and out. Okay, now do the other one. And do both. Now close your eyes and tell me what you are smelling.
Coffee.
Coffee. Good job. All right. Cranial nerve dose, which is the optic. So first, I'm going to check your visual acuity with a Snellen chart. So about 14 inches away, just at the end, and cover your left eye for me, or whatever eye, and tell me the lowest line you can read.
372646.
Good job. Now read another line backwards with the other eye closed.
683279.
Good, on both eyes.
646273.
Dang, all right, get 20/20 and then both. All right, look at you.
Yeah, I'm nearsighted, you know.
Yeah, hey.
Put that far away.
A little cheater, I'm not gonna say. All right. Yeah. All right. So next, I'm also going to test your the visual fields.
Okay.
Actually, we'll do that again. So cover whichever eye, and I'll cover the same one. Good. Let me know when you see my fingers wiggling. All right.
Yes. Yep.
Okay.
Yep.
And
Yes.
good. Now switch. Ready?
Mm-hmm. Yes.
Okay.
Yes.
Mm-hmm.
Yep.
Mm-hmm.
And yes.
Whoop. Catch your arm. Good. And now lastly, I'm going to do the optic, the fundoscopic exam. So let's turn this light off. All right. So I'm basically just going to be inspecting the structure of your eye, like your retina, macula, optic disc, looking for the red reflex, checking the blood vessels. So just stare ahead in the front for me, and I'm just gonna check out the eye. See the red reflex? Yep, going in. Try to make it quick. There you go. Good. Yep, all right. And straight ahead for me, just testing the other eye, looking for the same structures, which is the macula, optic disc, retina, and looking at the red reflex. Good. Going in. All right, good job. All right, that part is El Dono. Now for cranial, I should keep that off. Cranial nerves 2 and 3 on my test for direct aconsensual lighting. So I'm just going to shine into one eye, see it for pupillary reaction and for consensual reaction. Good. Let me adjust. All right, ready? Doing one eye. Good. And consensual reaction. Perfect. All right. Now that was cranial nerves 2 and 3. Now if I'm going to test cranial nerves 3, 4, and 6, doing extraocular movements.
Turn the light back on.
Oh yeah. Good. So we're going to do extraocular movements. So 3, 4, and 6 are the ocular motor nerve, trochlear, and then also the abducens. Again.
I feel like I have eyelash in my eye. No, I got it.
Yeah. Right.
Yeah.
So just follow my fingers. All right.
Okay.
Follow my finger.
Okay.
Don't move your head. Good. All right. Checking for extraocular movement. I'm checking for nystagmus. All right, so follow my finger. Checking for any twitching, I guess, but it was a smooth transition, so that's good. And then lastly, I'm gonna check for convergence. So follow my finger to your nose. Awesome. All right. And then lastly, I'm gonna check for ptosis.
Another one. Okay.
For any dripping of the eyelid, besides any eyelashes, you're doing all right. Good. Okay, so that is cranial nerve 3, 4, and 6.
Okay.
Now for cranial nerve 5, I'm going to be the trigeminal nerve. I'm going to be assessing your facial nerves. So first I'm going to assess the motor aspect of it.
Okay.
So I'm going to assess your temporal muscles. Good. Masseter muscle. I want you to clench your jaw for me. Perfect. All right. And now I'm going to assess for the sensory aspect of it. So we're going to do light touch and then superficial pain.
Okay.
So I'm going to be, so this is light, this is a superficial pain.
Okay.
And this is light touch.
Okay.
I'm going to be doing it to your forehead, your cheeks, and then your jaw.
Okay.
Just let me know like what you feel.
Okay.
So close your eyes.
Sharp.
Uh-huh.
Light.
Uh-huh.
Sharp.
Mhm.
Light. Sharp.
Yep, good.
Light.
Mm-hmm.
Sharp. Light. Sharp. Light.
No, sorry. Not bad.
Sharp.
There you go.
Light.
Good job. All right. So that's testing cranial nerve. Trigeminal nerve, actually, cranial nerve 5. And
Another eyelash. It's crazy. Oh my god. Okay, sorry, keep going. I pulled out like 5.
all right. So and in this case, I would also be assessing the temperature for sensation on your face by doing the cold with the tuning fork and the warm with the back of my 2 fingers. And then for the corneal reflex, which is also deferred, which is what I'd be doing, so I'd be trying to touch your cornea, and then you should blink instinctively, but we're gonna just skipping that.
Okay.
So for cranial nerve 7, the facial nerve, I'm going to be assessing, so just raise your eyebrows, good, and close your eyes. Try to resist me opening them. Good. All right, now I want you to show me your teeth. Actually, smile, I mean. Good. Show me your top teeth. Show me your bottom teeth. Frown. And about the cheeks. Good. All right. Now, for cranial nerve 8, which is the vestibulocochlear, we're going to be checking out your hearing. First, I want to assess your auditory canal, or the patency of the canal, by just looking inside, make sure there's nothing, wrong in there. See if I can see the good old TM.
Right.
So just take a little peek-see. Man, look at that.
Clear?
Clear. A lot clearer than mine, probably. So, let's see. Good. Man. This one's my ears. I'm jealous. All right, so looking clear there. Now we're going to test your auditory acuity. So if you guys just face that way for me. I'm going to plug one ear, then I want you to tell me what you hear in the other, all right?
C46.
Good. And the last one?
7H4.
Nice. All right. And lastly, for the tuning forks, we're going to be doing the Weber test, checking for lateralization of the sound, but let me know if you hear it in one or the other, or if you hear it in both.
Okay.
All right?
Both.
Good. All right, so now I'm going to I'm going to do the Renee test, which is testing bone conduction, which should be less than air conduction. So I'm going to put this on your bone back here, and let me know when it stops making a noise, and then let's see what happens.
Okay. Ah, yep.
Yep. Good. All right, I'll do this hard.
Okay. Yep.
Good. All right. All right, so that was cranial nerve 8. So now for cranial nerve 9, which is the glossopharyngeal nerve, we're going to be assessing. I just want to see you swallow for me. Good. And we would be doing the gag reflex, which I'd be putting some type of like tongue compressor in the back of your throat on either side of the uvula, or like either side of the arches of the hard palate, assessing for gag reflex. That'd be deferred. So now it is cranial nerve 10, the vagus nerve. So we're going to be assessing, throughout the exam, I'd be assessing the foundation of your voice. And now I would like you to stick out your tongue, and I'm going to look inside, looking for symmetrical elevation of the uvula. And say, ah.
Ah.
Perfect. All right. Whoa. Did you hear that?
Yeah.
I breathed in. My cranial nerve 11, I will be testing the accessory nerve. So I'm inspecting the trapezius muscles, Looking for any fasciculations, which I don't see any. Now I want you to raise your shoulders against resistance. Good. Testing the strength of the trapezius muscles. And lastly, I'll be inspecting the sternocleidomastoid muscle. So I want you to turn to the right against resistance. I'll be palpating this side. All right. Turn to the left. Palpating this side. Amazing. All right. And lastly, for cranial nerve 12, for the hypoglossal nerve, I'm going to continue it. I'm going to be inspecting. Let's see, where's the lights up in my pocket? I would like for you to stick out. Actually, no, open your mouth for me. I'm just going to inspect the tongue at rest for any asymmetry, atrophy, or deviation from midline. I want you to stick at your tongue and move from side to side, looking for symmetrical movement. Last, all right. I'm going to place my hand on your cheek and I want you to push again with your tongue. Good. I'm testing your lingualis muscle. Nice. All right. Perfect. All right. Cranial nerves. Done.
Done.
Okay. Now for the motor stuff. All right. So if you just have a normal seat, sit down and relax for me. I'll take a chill. Very good. Assessing the musculature of the body. So checking the symmetry, the size, the shape, the bulk of your muscle. Dude, yeah, freaking swole. All right. Good. Now I'm going to test the tone of your muscles with passive movement. So if you would like to face me, I'm just going to move some of your joints passively, testing for the tone. So we got the wrist flexion, got an extension, got the hand flexion and extension, got flexion and extension of the elbow, and we got flexion and extension of the arm. Perfect connection on the face of the leg. Do the same thing with the other hands. We got flexion, extension of the wrist, flexion, extension of the fingers, flexion, extension, and flexion and extension. Amazing. And you just want to lay back for me, please. And I'll just be doing circumduction of the lower extremities. So going one direction. All right, good. And the other direction. All right, good. And the same thing for this one. Amazing. Whoa. Good. All right. May you have a seat for me, please. Now, not lastly, but we're going to be doing some muscle strength tests. So, let's see. Okay. Here comes the fun part.
Yeah.
So, we're going to be doing some movements against resistance, and I'll say what to do. So, if you could flex your elbows for me. Good, against resistance. That's testing cranial nerves. Five and six. Give me a second.
Take it. Yeah.
Yeah. Mm-hmm. Okay, ready. You do it again. 6. This cranial nerve 6, 7, and 8. And then moving on. So then wrist extension against resistance. So if you push your hand down, good, on that side. And then on this side. And that's cranial nerves 5, 6, and 7. Okay, now that's the exact same thing as the elbow one. Alright, coming back. Alright, so I'm gonna go like this. I want you to squeeze my hand as tight as you can.
Okay.
And go. Good. That's cranial nerves C7, C8, C1. And then for the fingers, I want you to do thumb opposition. So fight it. Good. Do the same thing here. And that's cranial nerves C8, T1. And then I want you to do abduct the fingers. So that's the same cranial innervation. C8 and T1. Good. 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 Alright. Now for the lower extremities. If you could lay down for me, please. Amazing. Alright. So now here comes the fun part.
Okay.
So we're going to do, I want you to see.
Let me see.
Yeah. I want you to raise your leg against resistance. Good. So hip flexion. That's L2, L3, L4. And then I want you to you slide over to the side a little bit. And I want you to do hip extension. So go down. Good. And that's cranial nerve S1. Amazing. And then I want you to AB duct the leg. So that's, AB duct the hip, I'm sorry. So that's L4, L5, and S1. Then do the same thing on this side. L4, L5, and S1. And then I want you to AD duct the leg. L2, L3, L4, and the same thing on the other side. L2, L3, and L4. And for knee extension, against against resistance, that's L2, L3, L4, and then flexion is L4, L5, S1, and S2. Same thing here, L2, L3, L4, and then, extension was L4, L5, S1, S2, and then flexion is L2, L3, L4. Okay, now for plantar flexion, that is, I want you to push my hands against resistance. Good, that's S1. And then dorsiflexion, L4, L5. Amazing.
Nice.
Okay, done with that motor aspect of it. Okay, now for cerebellar stuff. Okay, so now we're going to test for the rapid movements. So yeah, that's on the side. So I want you to go like this and go back your hand and top of your hand as fast as you can. Good. Now touch each finger into your thumb as fast as you can. Amazing.
It's kind of hard.
Good job. All right.
Okay.
And then lastly, I want you to like tap on my hand as fast as you can. Good. This one. Good. Okay, good. All right. So now we're going to be doing some point-to-point tests. All right. So I want you to touch your nose, touch your finger, touch your nose, touch your finger, touch your nose, touch your finger. Good. And switch hands. Nose, finger, nose, finger, nose, finger. All right. Good. Now I want you to touch my finger, raise it above your head, touch my finger. Do the same thing, but close your eyes. Good job. All right. Now do the same thing with the other hand. Good. Now close your eyes. Close. Good. All right. And then lastly, I want you to do the just keep going through it.
Mm-hmm.
Then I want you to sit here, and I want you to take your foot, go from the top, and go down, touch your toe, and do that here, down, touch your toe. Do the same thing, but close your eyes. Amazing, from knee down your shin to your toe. Awesome, good job.
Thanks.
Okay, now for more of the gait stuff. So that'd be of like cerebellar, like assessment. So you can stand right next to me for me.
Should we? That's probably fine.
Yeah, we can move it up. If that helped at all. Yeah, okay, good. So I'll just be watching you. Make sure you don't fall. So just walk normally. This way for me, please. Thank you. And if you walk heel to toe, heel to toe. Good. Walk on your tippy toes. Okay. And I want you to walk back on your heels. Good. Good. And then I also want you to hop on one foot, hop on the other. Good. Now I want you to take one and just go down a little bit. Another one, and both. Good job. All right. And lastly, we're going to do some stance testing as well. So we're going to do the Romberg test. So I would initially have you stand here with your arms by your side, eyes open for 20-30 seconds. And then I'd also stand on the side. Now I want you to close your eyes, and I'd just be assessing to make sure there's no swaying. Good. So I'm doing that for 20 to 30 seconds as well. And then, oh, geez, sorry. And then lastly, I would do the test for pronation. So I want you to stand out with your hands up like this, and straight, feet straight.
Good.
Good. And I'm going to push down when you have your eyes closed, and I want you to bring them back up to position.
Okay.
Good. So now we're done with that.
Nice.
Yeah, so you can have a seat if you'd like. So now we're done with the cerebellar test. Now for some of the senses.
Mm-hmm.
So
I'm just gonna move this down a little bit.
okay. Now we're gonna do. Let's see, where's that? Sharp and dull. All right. So we're gonna do superficial pain, and we're going to be doing dull. So let's see. I want to show you. This is going to be superficial. This will be pain, and this will be dull.
Okay.
So, as you close your eyes, I want you to tell me which one's which.
Okay.
All right, ready?
Sharp. Dull.
Okay.
Sharp. Dull.
Face would be C5.
Sharp. Dull. Sharp. Dull.
Shoulder is C4. Thank you.
Sharp. Dull.
And then the medial aspect would be T1.
Sharp. Dull.
That's C6.
Sharp. Dull.
So, yep, the lateral side of the arm would be C6.
Sharp. Dull.
Medial aspect would be T1. And then for the, could you keep your hands up?
Oh,
Honey?
yeah.
And then we're going to do the fingers and thumbs, so you close your eyes.
Okay.
So thumb
Sharp.
would be C6.
Dull.
Middle finger,
Sharp. Dull.
C7, and pinky.
Sharp. Dull.
And then pinky,
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Oh, dull. Sharp.
ha, gotcha. So then the pinky is C8, middle finger is C7, and thumb is C6. Amazing. Oh, now we got to do the lower extremities. So, yeah, we can do it.
Close my eyes.
Now close your eyes, all right? So the thigh,
Sharp.
sorry, that is L3. It's working fine.
Dull. Sharp. Dull.
Then the medial aspect of her leg,
Sharp. Dull.
that is L5. The medial aspect, the lateral aspect
Sharp. Dull.
is L4.
Sharp. Dull. Sharp. Dull.
And actually, the medial aspect of the leg is L4. The lateral aspect is L5. So let me correct that. So thigh, L3. Medial aspect, L4. Lateral aspect, L5. And then last, we're going to do the pinky, which will be S1.
Sharp. Dull.
Okay.
Sharp. Dull.
Amazing. Oh, all right. And then we're going to do the light touch. So then this is what light touch feels like.
Okay.
We're going to do the exact same thing. So let me know when you feel something, all right?
Okay. Is there hair on that?
No. Well, it's on the finger, actually.
Okay. Okay. Yep. Yes.
Face is C5.
Yep.
Let's see.
Yes, I feel it.
Okay.
Yep.
That would be C4. And then if you can go like this for me, please. Good. The lateral aspect,
Yeah, sorry, yep.
C6.
Yep.
T1.
Yep.
Medial aspect is T1.
Yep.
Lateral aspect is C6.
Yep.
Thumb.
Yep.
Is C6.
Yes.
Middle finger is C7.
I feel it.
And then C8 would be pinky. Do you feel that, pinky?
Yeah.
Good. Alright, so now for the light touch, it'd be a little difficult, but close your eyes and
Yeah.
try to do as light as
My
possible.
imagination. Yep.
Okay. L3 on the thigh, the inner part or the medial aspect of the calf.
Yep.
Would be L4.
Yep.
And the lateral aspect.
Yep.
Is L5.
Yes.
And then pinky, and then
I
let
see.
me take your socks off. There you go.
Yep.
And that's S1.
Yes.
Okay. And then it's deferred, but I would be doing the temperature test or temperature sensation as well, which I'd be using the cold as the tuning fork and the warm as the back of my fingers, but that's being deferred for now. And then I would also be assessing your medial part of your buttocks, which is S2 for all the senses, which I start as S3, but it's being deferred for patient, privacy.
Oh, thank you.
Yes, of course. And then now, here comes the fun part, vibration. Using the 128 hertz tuning fork.
Nice.
So just let me know when you start feeling the sensation.
Okay.
Vibrating, alright?
Okay.
So,
Yeah, feeler.
yep, doing the
Yes.
clavicle. Doing the olecranon process.
Yep.
Doing the ulnar styloid.
Yep.
Or
Feel
styloid,
that.
sorry. And doing,
Yes.
okay.
Yep.
Good. And we're doing the DIP joint.
Oh yeah,
Oh yeah.
big time.
Good. And if you could just possibly show some of your anterior spine. Thank you.
Yep.
Good. Good on that side too.
Yep.
Alright. And patellar.
Mhm.
On the patella. The medial malleolus.
Yes.
Okay.
Yes.
And then on the interphalangeal
Oh yeah.
joints on the
Yes.
toes. Amazing. Good.
Good.
That's vibration. Now for the special tests, like proprioception.
Mhm.
So for that, we're going to be testing for if you have a posterior column disease. So I'm going to grab one of your joints and I'm going to move it up or down. I want you to tell me if your finger's up or down.
Okay.
Ready?
Up. Down.
Okay.
Up. Down.
Good. Alright, now I'm going to check for stereognosis. So I'm going to, if you sit back and close your eyes for me, please. Oh. Tell me what is in your hand. Alright, so we got, yep.
Remote. Phone.
Nice. Good job. Alright, so now we're going to be doing number identification. So I want you to open up your hand for me, please, and I'm going to draw something on there, like a number or a letter. I want you to tell me what it is.
Okay.
Alright, ready?
Mhm. 3.
Good.
Can you do that one again?
Yeah.
4.
Yes.
Okay.
Good job. Alright, so now we're going to do 2-point discrimination, which is, alright. So I'm going to either do 1 poke or 2 poke, and I want you to tell me which one it is.
Okay.
So, ready?
1, 2, 2, 2, 2, 1, 2, 1.
Good job. Alright, so now we're going to do point localization. So I'm going to point somewhere on your body, and I want you to tell me where I pointed it to.
Okay.
So you can close your eyes. And good. 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 Now I'm going to do an extinction. So I'm going to point in 2 places, and with your eyes closed, I want you to tell me where I pointed at you.
Okay.
Ready?
Here and here.
Good.
Here and here.
Good job. Alright. So now we get to do some of the fun stuff. We get to do reflexes, the deep tendon reflexes.
Okay.
Alright. So if you can just sit normally for me, please. I'm going to do your bicep reflex, which is C5, C6. So I'm going to do this. There you go. And we'll do the brachioradialis, which is the same cranial nerves, C5, C6. And then the tricep, which is C6, C7. Good. And I'm going to do this on the other side. Which is C5, C6 for the bicep reflex. Ah.
Ah.
And the brachioradialis is C5, C6. And then tricep reflex, C6, C7. Nope. You got too low, I got too cocky there.
Mm-hmm.
Alright, now we do the lower extremities. So we're going to do the patella reflex. Good old patella reflex, which is right there.
It's good.
Yeah.
Oh my god.
L2, L3, and L4.
Yes.
And then lastly, we're going to do the Achilles tendon reflex. Oh, you can see it's good. All right. So actually, I'm going to have this up here. Just gonna have it nice and loose. Ah.
That's good.
Oh, yeah. Good. And that would be ground nerves L4, L5. All right, now we get to do clonus. All the fun stuff. Okay, so I'm going to be checking for clonus, moving it up and down, then holding it, and then seeing if there's basically any clonus.
Okay.
So go up, and hold. Good. All right. Same thing on this side. Good. All right. Good job. Jeez, it's hot.
Yeah.
All right. Now, after clonus, we're going to be doing some special tests. So, well, I'm just going to do this one first. This is what came to my head. We'll do the Brzezinski sign.
Okay.
So if you just lay down for me, have your leg extended for me. And this would be testing for if they have like meningeal, actually if you lay flat, that'd be great. Yeah. Thank you. Alright, this would be testing for meningeal inflammation. So I'm going to raise the head and I would notice any hip or knee flexion, which would be a positive sign, which she doesn't have. Amazing. Alright, so then for the Koenig sign, we'll be also testing for meningeal inflammation. So I'll be bending the knee and then extending one leg, and then she should feel bilateral pain if she had meningeal inflammation. Do you feel any pain?
Nope.
Great. Same thing on the side. I'm gonna bend it. All right. Any pain at all?
No. I mean, just it's a little tense, but I think just 'cause I'm a little sore.
You're all sore?
Yeah.
Makes sense. Okay. Okay. Let me get this. So we're gonna do some of the abdominal reflexes. So if you mind showing your abdominal area.
Yeah.
All right. So the upper abdominal area above the umbilicus would be T10, T11, and T12. Good. And then actually, let me say that again. This is T8, T9, T10. The above the umbilicus, and below the umbilicus is T10, T11, and T12. Good. Good job. Oh,
Thank you.
before I put this down, if you could actually just sit up for me, I'm going to be testing the plantar response to moving this from the bottom of your heel to the top of your foot.
Okay.
And you should, yep, you
I
should.
don't like it.
Should have plantar flexion with this, which you do. Good. And that is L5 and S1 response. Okay. So we're going to be doing the testing for asterixis. Yes. This is basically testing for medullary encephalopathy. So if you could just stand up for me, please. And stick your hands out for me and extend them downwards. Amazing. So I just be testing for any like twitches or flopping of the hands, which she doesn't seem to be having. Great. All right. Now we're going to test for the wing scapula. So if you just come over here and place your hand on the wall and push for me. Good. These would be no protrusions or abnormalities in the back. Great. And let's see. I'm trying to think if there's anything that I forgot. All right. To restate.
You want to redo?
Just to restate the cranial nerves or something.
Cranial nerves?
So, for inspecting the arm strength of the upper extremity, this elbow flexion is C6, C7, C8, and then wrist flexion or extension is C5, C6, C7. It doesn't feel right. Actually, no. C6, C7, and then C6 and C7. That's my final answer. Could be wrong,
Okay.
so I'm gonna stick with it.
All right.
And that's all she wrote.
Nice. Good job.
Nice.
That's good enough.